Welcome back to Delatory Stories, where we interview local legends, business owners, and other interesting people. Today we have with us Logan Lamb. He is a chiropractor with a little bit of an unconventional approach.
Yeah, my name's Logan. I am a chiropractor in Cookeville. I got my doctorate this past December in 2024, so I'm just now starting kind of my own personal practice. I went to school out in Kansas for undergrad in 2016, graduated, didn't know what I wanted to do, and then I moved to Georgia to pursue a master's degree in exercise physiology, where I also got credentialed in the American College of Sports Medicine as an exercise physiologist. Because I wanted to work with people, especially people in pain, and I thought that was something that I was being called to do, and then that's what kind of led me to chiropractic, and then I went through that whole process, and yeah, I graduated this past December. Now I'm kind of doing my own thing.
So what was that process like going in to be a chiropractor? Because it's a little bit different. Like being a chiropractor is kind of its own little community, kind of a space, I guess I'm trying to say, off from like regular doctors and people in the more the medical side of it. It's kind of its own little thing, isn't it?
Yes, for sure. Yes, chiropractic is a type of, how I like to define it personally, it's a form of conservative musculoskeletal management. So if people are dealing with aches and pains related to muscle, joints, or other soft tissue related disorders, then I think conservative management, I think chiropractors are a great place to go. Similar practitioners include physical therapists, trainers, athletic trainers, personal trainers, and then there's a whole kind of another world of kind of holistic health, including like massage therapists and nutritionists, and it's a pretty umbrella group. But yeah, as opposed to very kind of modern medicine, which kind of includes medical doctors and osteopathic physicians.
So what was that schooling like for the chiropractor?
Yeah, I really didn't know much. I honestly chose to be a chiropractor because of all the unique experiences that I've had leading up to me going to school. I had been treated by a chiropractor when I was actually living in Cookeville, and I really liked him, but I didn't really appreciate or understand what he was doing. And then during kind of my undergraduate degree and then pursuing graduate studies, I got to interact. My opportunities kind of let me interact with kind of the world of medicine in a sense. I got to work fairly closely with almost every type of practitioner, and all of those experiences kind of actually pushed me towards chiropractic, which I didn't really know what it was, like I said, until I actually got there, because it wasn't at all what I expected.
I think that's what a lot of people, just regular average people, they kind of, like you said, you don't really know what you're getting into if you're going into that.
For sure. Yeah, lots of people have lots of questions, and then the chiropractic curriculum kind of teaches future chiropractors to kind of communicate and behave with patients and clients in a very specific way that really turned me off. The very first year of chiropractic school is very philosophically based. So there's a lot of narratives that chiropractors tend to throw around, even today, even now that I've experienced working with other people, about various things. Like a very common thing you might hear at a chiropractic office is, my bones or joints are out of alignment, which that's a very old and very not true statement to make, because joints don't necessarily go out of alignment. And we're trying to describe something that is something that's very normal. Like, people deal with aches and pains, and kind of pain is kind of a normal process of being a human. And I think lots of practitioners in multiple fields have kind of made this mistake, but we kind of look at people from kind of the lens that we're taught. For example, I can't think of it was like this parable or something. It's like 9 blind men are touching an elephant, and then, the one that's touching the tail thinks that it's a rope. The one that is touching the trunk thinks that it's a snake. One that's touching a leg thinks it's a trunk of a tree. One touching its body thinks it's a wall. One touching its ear thinks that it's some kind of fan. And I think that healthcare providers fall into a similar camp. The chiropractor's touching the tail and tells you that you have a joint misalignment or you have a subluxation. The physical therapist is touching the trunk and says that you have you have some kind of weakness in your muscles that's contributing to your pain experience. An ortho might say, oh, you have degenerative disc disease showing up on your x-ray. And, just all these providers, we have like our biases that come from, where we're taught.
Yeah, it's just human nature.
Yeah. So, and I don't really fault each of these professionals for kind of falling into kind of their biases. Cause like I said, that's kind of the way we're taught to interact with, making sense of pain. And I think that really kind of boils down to it is that pain is such a multifactorial experience. I can't think of the title off the top of my head. There's a paper that was written in 2018 by an author named Kolecki. And he basically summarized how I described the elephant. It's like pain is just this experience that we really can't reduce to these moments that we experience with a very conventional model of care. For example, like if you came into a clinic, a very normal clinic for like a chiropractor, it's pretty common, like how I was taught. We ask you where it hurts, when did it start, the quality of the pain, like is it sharp, dull, icky? Does it move anywhere? Is it radiating anywhere? And how long does it last? And usually we kind of stop there and we do a physical exam and then we treat whatever, that particular thing was. And I feel like lots of healthcare providers do the same thing. And that's kind of my beef with it. I was like, well, maybe the incidental findings that you find during that very quick kind of script, what you see and what it is and how does it feel, maybe doesn't represent really what that person's experiencing. And that's what those authors in that paper that I described are really after. They're saying, like, for example, one big category is like just specifically biological. And that's usually the camp that us conservative healthcare providers fall into. Personal trainers, PTs, chiros. We like to think, your problem is because of your poor posture. And then, your problem is because you have weakness in these very specific muscles, or you choose to behave this way, or you have text neck, or, we love to make all these crazy big labels for things that we just see in our very small camp. And then, of course, but what we don't really take into account is lifestyle factors, constitutional factors, maybe just age-related, behavioral, like what's going on in that person's life. It's like stress is kind of a huge one, or like how are they sleeping, or how are their relationships with people. Just kind of meeting people where they are and letting them have an opportunity to kind of express that can help, I think, paint a better picture. Because that's another problem is that providers, we are so obsessed with finding an answer that oftentimes I think we miss the opportunity to maybe just be comfortable with the unknown of pain. Maybe it's okay to not have an answer, and maybe letting the person in front of you kind of express to you, what are their primary concerns. Maybe we can get closer to that as opposed to just finding something very structural. And that's kind of, I had a wonderful mentor in chiropractic school that I met after my first year, and he said I was really big into reading, and I still am, but I read a lot of papers in chiropractic school that really just swayed kind of my opinion of not just chiropractic, but just healthcare as kind of a whole. It's like, man, I think all of us are kind of missing the mark, and I'm just constantly and that's my encouragement to other providers. I actually just was talking to earlier this week. She's a PTA, physical therapy assistant. And I was like, hey, I just gave her a few papers. I was like, you should read these because like you're interacting with humans that have so many things that you just don't understand. And it's going to help you just appreciate that and be comfortable being uncomfortable. So I just love kind of challenging people in my own cohort I graduated with. And I graduated with a really good group. But that just goes to show I graduated with over, I think, 140 people. I would argue that the vast majority of my group, maybe 70%, lives within that very conventional model. And then maybe the 30% of us that are not in that model have adopted like kind of our own strategies. And then there's like this really small percent that's like, maybe like not really reliant on too many like systems or techniques, and are just really just, I like to describe myself as like very goal oriented. It's like I don't, whatever tool I can use to kind of get someone to whatever they care about, I'm okay employing it. I'm okay with not thinking that there's a right or wrong way to do it. But I feel like I just went on a crazy tangent.
No, you're good. Yeah, like you said there's really, especially in your field there's different ways you can go about stuff and get to the same answer.
Mm-hmm.
It's I guess that's really just with anything. You can go about things totally different ways and you can still help the person.
Right.
And that's really the main goal in the end, is to help your client, correct?
For sure. For sure. Well, and that's the nature of it. And that's the beauty of it, actually, is that there are so many ways to do it. But the problem to me is that, and the current body of literature is kind of at a standstill on this, none of those ways are necessarily better than others. And I think that's sometimes the problem, is that, and I'll use chiropractic as an example because I'm a chiropractor, is that when you come into an office, me and the way I kind of, hopefully a more evidence-based practitioner and a very conventional chiropractor, we can have the same patient and him and I or her can apply the exact same treatment in the exact same way with the exact same amount of force and the same trajectory. Everything could be perfectly the same. How we communicated that care to that person in front of us that day, that to me is where the therapy occurred. For example, in my opinion about chiropractic is pretty different in the sense that when you go to a chiropractor, what I think we're really, really good at is not realigning anything that's out of place specifically. We're not correcting anything in your spine or your extremities that has some kind of problem. What I think we're really doing is, if you come in with some, like low back pain is the most common. You come in with low back pain and I adjust your low back. What I'm really doing is just helping those joints that were a little bit fearful of interacting with motion, because that's usually what happens. You're like, man, these movements are really tender. And what chiropractors are really doing, we're actually guiding you to those positions that are tender for you and just moving you quickly in them. And we're really kind of, I like to think that we're just really kind of convincing a system that's like red hot that it's not, because that's the nature of most low back pain. And that's actually the nature of most kind of musculoskeletal pain syndromes in general, is that 90% of them are classified, we can put in the camp of non-specific, which means that really there might not be a true mechanism of injury, like that other 10%. And that's really my job, I'd like to think, and should be the job of any practitioner in our space, is that our job when you come is to rule out any pathology that might exist. So if there's a real injury, like if you have a fracture, if we suspect an infection or any type of inflammatory, if there's really anything that we need to be able to refer you on to someone more appropriate, that's our job number one. And that's what the current clinical guidelines wants us to do. That's number one, rule out red flags. Once we do that, really, however we classify an issue, it almost doesn't matter, because the vast majority of people with just non-specific pain, like I described, where we really can't kind of narrow down a very specific mechanism, is almost self-limiting, which means that it will get better with time, which is kind of the catch-22, is like lots of these treatment plans that exist within chiropractic usually exist on a 6 to 8 week scale, and usually people go to a healthcare provider. If we use like a regression to the mean, if we use like this progression, a bell curve, most people tend to go to and see a healthcare provider when they're at the top of that bell curve, when they're in a lot of pain. And the nature of it is that if they would have just held on a little bit longer, their symptoms would have reduced. But we tend to, on average, people tend to pursue help at the top.
Yeah, that's what I did actually back in, I guess it was in November. I had done something to my shoulder and I was just in agony over my shoulder. But I waited just exactly like you said there. I waited a couple weeks and it just kept getting worse and worse and worse. And finally, it just got to a point I could barely even move it. I couldn't do anything. So I went to the doctor about it and got checked out and ended up having to go get an MRI and all that stuff. And then, of course, they gave me a cortisone shot. And, of course, that didn't kick in for like 10 days or something.
For sure.
After. And, I mean, I was in the top of the pain, like you described there. I was at the top of my pain. But really, probably, I'd say a month later, if I just waited, like you said, if I'd waited a few more weeks, it would have went away. And which I'm sure the cortisone shot definitely helped it.
For sure.
But it ended up just drifting away, and it was fine after it calmed down for a little while.
And that's the nature of it. A chiropractic adjustment, a cortisone shot, massage therapy, a little bit of PT, scraping, cupping, lots of these therapeutic tools. Any of those things could have been employed in your case, and they all would have worked. And don't get me wrong, and I think that's the wonderful thing, and that's the powerful thing about, to me, is my superpower as a chiropractor, is that an adjustment, like most of these other modalities, it can really help reduce pain that's pretty intense. And that's really our job. It's like, hey, and I love to be honest with people. I'm like, hey, this is there's a quote by a physiotherapist in the United Kingdom. His name's Ben Cormack. He likes to say, I think he specifically says it for low back pain, but I'll use just pain. Pain, musculoskeletal pain, is very rarely seriously dangerous. Very rarely seriously dangerous. But it is most often seriously painful. So, but I love that. It's because, like, if you came and saw me and I was able to rule out that seriously dangerous category, which is pretty rare, and it sounds like it was ruled out for you, then now I can tell you, it's like, hey, I know this is seriously painful for you, and this is what we're going to do. These are some of the options that we have to help modulate your discomfort while you come back down off this curve. Mm-hmm. And that's really, I think, what happened to you. It's like you were at the top, you wanted answers, you wanted to find out, was this seriously dangerous, or is this just a seriously just painful problem? And that's what happened. You pursued care, and then someone gave you a strategy that helped modulate, calm down those symptoms while you continue to return back to the mean, which is an amazing thing. It's like, and people just need to be, and that's my thing. It's like, I interact with people in pain every single day. And oftentimes I could not put my hands on someone and I feel that they leave feeling better simply because they understand that maybe this isn't a serious problem. We ruled out the serious problem stuff, and now we're seriously in pain, because that's a huge, and when I was describing that pain is multifactorial chart, a big category is just your beliefs. So like if you hold on, like for a while there, you're like, oh no, something might be seriously wrong with this, because you were just experiencing that normal, maybe you mildly strained your shoulder. I'm not 100% sure, but most of those things tend to get better in a few weeks to maybe just a month or two. And just having a provider, and that's why I love people to go to their providers, so they can go be like, hey, please be assured that maybe this problem, we ruled out the serious pathology, so we're just going to ride this wave. However, these are the tools that I provide. And that's when I think you should have the autonomy to kind of pick the route that you like. It's like, oh, I've responded really well to massage therapy in the past, and it'll be like, wonderful, maybe go do that. It's going to help kind of calm down this fire that you got going on in your shoulder as you continue just to recover naturally from it. Yeah. And I think people just need to be told that.
I agree with that. People really, the main thing people are looking for when they go see any kind of provider is comfort.
For sure.
They just want comfort. They want comfort in their mind, like you said, that it's not the serious problem. Because as long as you know, like my shoulder, for example, I was in such great pain. I was thinking something has to be tore in there. I've done something. I've really messed it up. I'm going to have surgery on it. Mm-hmm. And that's just what I thought. And every day that it got worse and worse, and it was so painful, I was like, it's got to be something like that. And it wasn't in the end. And after I got that assurance, It's like, well, I can kind of relax now and know that it's eventually going to be okay.
Mm-hmm.
And it was, but that comfort that you get from going somewhere and having somebody at a professional level tell you that you're going to be okay, there's just no better feeling.
Yeah. And that goes back to my story about me, the two providers doing the exact same therapy with the exact same patient presentation. I tend to communicate with the narrative that I just gave you. Like, hey, based on the history that you told me and the physical exam that we just performed, I think you're in wonderful shape. Your muscle strength was great. I love to do a neuro exam and then check your vitals, check your range of motion, feel it, palpate it, see how the actual tissue feels. And I'll do that. I'll be like, hey, there's nothing crazy going on here. At this time, I don't think imaging would be warranted for you. I just think you're in that seriously painful category. But I can mobilize it today. We can do this type of care, and it'll hopefully continue to calm down. If it doesn't, we're going to reassess it, and then maybe pursue other additional strategies like imaging in case. But I have a good feeling that this is going to calm down. But then you have the other provider, and I think the more common provider, kind of in today's world, that kind of lives within kind of the narratives of their education. Like that provider, if we're talking about back pain, the reason that you're at the top of this bell curve is because your pelvis is tilted a specific way, your leg is long, one leg's shorter than the other, or you have a misalignment in between these particular vertebrae, and your shoulder's taller than the other. Oh, you would just have this classic over kyphotic curve because of text neck. It's like, I don't want to employ those narratives. One, because the current body literature has completely just debunked them. We're not there anymore. We were there, and that was kind of the renaissance of, I guess, musculoskeletal medicine was really in the 80s when all of these systems were just being born because all of us were just trying to understand, like, why are people in pain? And I think modern pain science has really led us to, honestly, we really don't know. But what can we really do? Let's spend time reassuring people, helping build their self-efficacy, kind of how they feel like they can handle their problem. And let's just start there. We can just dodge all these narratives because if we go back to the belief problem, like if you would have saw a provider that maybe communicated to you like, oh, your shoulder's out of alignment, I'm going to put it back in for you and you got to come pretty regularly so it doesn't slip out. It's like, oh no, then you're going to be a little bit more fearful, or maybe you're going to be a little bit more reserved with how you explore motion. Maybe you're going to avoid certain activities for fear of, because someone told you, someone that you trusted, a provider. And I think that's just the truth is like, a lot of the therapeutic kind of benefit to going a provider today, I think, rests in our words. How do we communicate with the person that day? Regardless of the treatment that we employed, if we built their confidence to interact with their pain problem, then I think we did our job.
Yeah, you have to connect with them on more of a level because you can't really generalize everybody because everybody's pain is different. And that goes back to, like you said, you ask them where the pain is at and what their pain level is. But when you're dealing with everybody, you're dealing with an individual who's lived a different life than everybody's lived their own life, and they're doing something different than this guy or this guy. Their pain level, if they say they're at a 8, that might be different than somebody else's 8. You can't really, if you're saying give it to me on a scale of 1 to 10, it's really everybody's 1 to 10 isn't the same. Because just take like, say my shoulder, I hurt my neck one time too. Say my neck pain was the worst pain I was ever in. But some other guy got in a car wreck and broke his leg.
For sure.
That was the worst pain he was ever in. So if I say mine's a 10 and his is a 10, I'm sure his leg probably hurt worse than my neck. But that's all I've ever experienced. So that's all I know to say,
For sure. Well, no, that's the nature of it. It's like, and I love that. It's like your pain is extremely subjective to you. And I've actually talked to clinicians in the past where someone comes in and they say that they're like a 6, 7 out of 10, 8 out of 10, pretty, how we would think of it, pretty severe. But then we kind of watch them interact with our physical exam. We watch them move around and they don't describe any discomfort. And then we're just like, and they'll look at me and be like, yeah, he wasn't a 7 out of 10. He was lying. I'm like, really? I was like, no. I was like, we can't decide that for people. Your subjective experience, your severe pain in your neck, and then the car accident breaking their leg, the context of those situations, your personal, and like we said, pain is shaped by not just the specific neck in your pain. It's shaped by like who you are. It's like, do you have family problems going on right now? Did a loved one just pass away? Are you having trouble at work? Are you unemployed? It's like all these things shape our pain experience. And that's why it's so important for providers to do a wonderful history taking portion of their exam. Just really let the person kind of express, their experience, because pain, that's really what it is. It's this experience. And pain's really misunderstood. Pain, I'll give you an example. Nociception is when nociceptors all over your body are just on your skin, like when you touch your skin. That feeling that you feel is just the nociceptors taking the feedback from where they touched you, running it up to your spinal cord, then running it up to your brain, and just trying to process it. And if I hit you on the arm, it's going to do that same thing. It's going to run it all the way up to your brain and be like, hey, we just got hit by something, and it was this level of like intensity. Then your brain's like, oh, I'm going to classify that as pain. So I need you to back away, move, duck, make some kind of decision. Really, that's what pain is. It's a response. And I'll give you, and pain's weird. For example, like if I pinched your skin, your brain's gonna be like, whoa, that was really, really painful. But then we'll look at your skin and maybe there's gonna be no difference in texture. So like pain sometimes isn't even a great predictor of tissue damage. And that's kind of the point that you're trying to make with your pain. It's like, man, my neck pain was so severe, but we didn't see there was no tissue damage present. You still have good range of motion. But the person that broke their leg, like, whoa, they broke their leg, but you guys are both experiencing pain. Mm-hmm. So it's really just pain. I like to think that pain is more of just an indicator that something in your environment, your body's environment, is just not where your nervous system really wants it to be. So it's trying to make a correction. So yeah, and I didn't mean to sway back off like that, but it's like how people describe pain. That's why we just got to take it for what it is. I was like, your pain is your own. How you paint that picture for me, I'm going to live right there. I'm not going to compare it to this guy. Because that'll just kind of sway, and I think it disappreciates kind of your experience if I'm comparing you to other people, because like I said, it's just so personal. But
do you think in today's world that a lot of providers just across all fields overlook how much stress impacts your pain levels? Because I feel like just your overall health in every way, that stress is probably the biggest thing that kind of amplifies everything, if that's a good way to say it.
Yes, stress is huge. And I think that comes down, and oftentimes providers don't really get to dive in deep with people. Like I think and that's one of the kind of my model is really, especially my first visit is like an hour long. And I usually tell people when we start, I'm like, hey, I just want you to tell me your story. And I'm going to do my best to not interrupt you. And I might prompt you with questions along the way. But this is a you-led interview. And oftentimes that's where like the truth comes out. Where like those stressors, like, man, I have this baggage. Because the most, and that's the kind of the example with like insurance. In the chiropractic world, chiropractors that are in network, they're really not incentivized to spend a lot of time with people because they're going to try and bill a few, like an adjustment code, a therapy code, and maybe a soft tissue code. And then usually most of that stuff takes about 20 minutes. So if you can keep those appointments down to 10 to 20 minutes, that way they can see more people so they can
make more money.
Yeah, make more money. So like, which makes it sad because they're incentivized to do that. Mm-hmm. They're not going to make any money if they're not getting more people. And the problem is those 10, 20-minute sessions like that, oftentimes if it's an established patient, they're much shorter than that, maybe 5-10 minutes tops. We just don't really get to like wrestle with people and wrestle with kind of their experience. And I think that's kind of common to people that go and see their primary cares. It's like they they interact with a nurse. She says she just takes a bunch of those, like that example, like where is it, what is it, how long does it hurt, where does it hurt, how does it hurt, and then their physician comes in and maybe just talks to them for a minute or two, and then they're gone. It's like they just give them a prescription or a recommendation for a shot or something. And it's like really sad because and they're not really incentivized to do that either. I think that's kind of the problem, is that
It's a broken system.
yeah, in a sense, and that's really kind of what kind of molded my model, and it's kind of unfortunate, but like I'm a cash-based provider, and I think that conservative musculoskeletal providers are moving in that direction because my appointment times are much longer, and I really think that I can connect with people, and that's really my goal. My goal personally in my business is to empower people to self-manage their pain problem as quickly as I can. So I want to see people, and I'd like to think that that's all of our goals really, is to be out of business. We want people to spend less time with us, feel like they can handle their pain problem as quickly as they can. But that's probably pretty far off. So.
So just break us down whenever somebody gets online and they go and they book an appointment with you.
Mm-hmm.
Just break us down. You talked a little bit about your consultation there. What does that look like? Say the consultation, the first appointment there, and then what you do when they come back for the second appointment.
For sure. I like to tell people that they'd likely have 1 or 2 visits with me, depending on the problem. Usually people that have like these kind of more acute problems, I tend to be able to hopefully manage it within that 1 hour. If not, the more kind of chronic pain oriented people, I tend to usually do 2 visits. But my model is like this. They come in, and how I described it, I'll sit down and basically just kind of give them a itinerary of what to expect. I say, hey, we're going to do this history portion, and I want you to just tell me everything that you think is related to this problem. And usually that can take the whole hour. 2 weeks ago, that took the whole hour, and they were super happy to come back because during our next appointment, we really got to do the next part of kind of my consultation. But I just love people to have an opportunity to speak because they often don't. I read something. It was like the average time it takes for a provider to interrupt a patient during their first consultation. I can't remember. It was, I think, around between 7 and 13 seconds. Like we just jump right in and want to kind of take control. And that's like something I've wrestled with. I'm like, nope, I want, and because I've told people that in the past, I'm like, hey, if you find that I might be interrupting you at any point, I want you to look at me and stop me because I want you to just have the floor. Today is all, like, this moment is all about you just inviting me in to better understand your experience. After I get the history, that's why I love the detailed history, because that multifactorial pain camp, because it's really overwhelming. There's like 100 items on it. But if you just give people an opportunity to express themselves, they will tell you the items on that chart that are valuable to them. So I make notes of that. After the history portion, I like to do a physical exam because it's my job to rule out the red flags. So I'm checking range of motion, I'm looking at the tissue, I'm doing orthopedic tests, a neurological exam. And after I do that, like I said, 95% of the time, that is crystal clear, 100% good to go. And then we can kind of put that person in this non-specific camp. And then after the physical exam, that's when I tell them, I'm like, hey, and I love this part. I'm just like, hey, based on everything I just learned about you and everything that you just demonstrated to me, your current pain experience is probably not severely tissue-based, which means that maybe your nervous system is just being a little goofy. It's interpreting the information, how we described. It's just interpreting information just poorly. It's just getting confused. And I use this example all the time with people. if you have low back pain, like recurrent low back pain, this is usually in the chronic pain group, which is a population of people I truly care about because they've been told all the crazy narratives about their pain. I usually tell them, I'm like, hey, you have this low back pain, and it's like your nervous system. Like if your low back was a house, and any of these movements that are provocative for you was like a candle in your house, it's not really just a candle for you. Your body is actually interpreting it like it's some kind of fire, and the smoke alarm's going off, the fire alarm's going off, the fire department, the police department, they're all being called to just come and rush that site because they think there's an active fire there, but really there's not. Your body's just kind of poorly just understanding this current situation. Like when you flex forward, and I give this example all the time, like the people that their back goes out when, that was air quotes, is that when like they pick up some groceries, it's like, and I tell people, I'm like, hey, based on everything you just showed me, your back didn't go out when you picked up those things, and usually these people usually have a great story, like, oh yeah, 20 years ago I was an athlete back in high school and college, and I used to be this strong, and then I had this one moment where like I had this injury, and because most of these people have like a moment in their past, or that they just, it's in that belief bucket, they just hold their past experience, they just hold on to it so rigidly. And I just confront them. I'm like, hey, maybe when that happened, your nervous system and your brain and your body just remembered it, because your nervous system has a wonderful memory, but sometimes it doesn't remember the sequence the way it should have. Because I would say like, yeah, maybe when you're deadlifting 400 pounds back then, and maybe you mildly strained your low back, and of course in a couple weeks to a month that likely got better, but your nervous system maybe didn't forget about it. And whenever you interact with something that it reminds it of that moment, like picking up some groceries off the ground, your body doesn't know that it's a bag of groceries. Your body's like, whoa, whoa, whoa. He's squatting in a very specific way. Is he about to pick up 400 pounds off the ground? Should we be prepared for it if he does? I don't know. So let's just recruit a bunch of muscles. Let's get them really, really tight just in case. And when your body's expectations don't meet the reality of the situation, that's when people, I feel like, have their back go out. So it's like nothing really went out. Your body just over prepared for something that it thought was going to happen, and it just didn't happen.
So you just think your body's misreading those situations sometimes, maybe based off something that happened in the past, and it's just being overprotective of itself.
Yeah, I think that that's very true for the vast majority of kind of chronic pain sufferers. Is that your body's just being a little confused. This phenomenon is called nociplastic pain, and we can describe pain in three categories. Nociceptive, which is like I get a paper cut, like there's an actual tissue damage that occurred. I broke a bone, I strained a muscle, nociceptive. Neuropathic pain is usually that group that they describe like sciatic pain, like there's nerve involvement. So like a nerve got compressed or stretched for a prolonged period of time, and now it's irritated. And then the weird group that I don't think is talked about often enough, that I think is true for the vast majority of people, is nociplastic pain, which is nervous system adaptations. And I'll give you an example. Like if a regular nerve was interacting with another nerve with like two neural connections to it, that's just normal. How I just said, like when you touch your body, it just interprets it and it's normal. Are you familiar with muscle memory? Like getting better at something the more you do it?
Yeah.
That phenomenon, it's a real phenomenon. The fancy term I think is called habituation, when it takes less neural connections to get the same feedback. So you just get more efficient at that activity. And that's usually a positive adaptation. But when your body misinterprets some of these things in that big web that I was talking about, I don't know if this is going to be like aired, but we need to pop that. I need to link that paper somehow. Everyone should go read it. When your body misinterprets that, it's called that nociplastic pain. So a normal neural connection now has more neural connections that kind of supply that nerve. So when like a normal activity, like bending forward for a lot of people, your body is misinterpreting, or like it has more signals interacting with that nerve. So it's like, whoa, 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 let's light him up. We're not sure what he's doing. And then that's when that whole, it's not a candle, it's a fire, panic, tighten him up, make him tight, make him rigid, give him pain. And that's kind of the nature of it. It's like your body's nervous system just adapted poorly. And usually it's the context of all those things, your beliefs, past experiences, your environment, what clinicians have told you. People get a lot of kind of their beliefs from their family and friends. And all these experiences just kind of shape how your nervous system is constantly adapting, which is just very interesting. And all that to say is like that, and that's what I love to do after my history and physical exam, because that story is very true for the vast majority of people. It's like, hey, the pain you're experiencing, it's seriously painful. Like, it's true and it sucks. But the wonderful news is that in the absence of all the seriously dangerous things that we just ruled out, we just know really that we're just dealing with a system that's just being goofy. And what this really does is it gives you permission to move. And that's when at that point in my consultation, and I usually ask them, and it usually comes out during the history part and the physical exam, all these moments in their life where they're like, yeah, I'm kind of fearful of that. Or like, I avoid this. I don't want to do that. That's dangerous. This person told me to not do that again. I was told to not lift. I was told to not run. Like, just the craziest things. I've heard all of it. And then I tell them, I'm like, hey, right now, I want to walk around this gym and I want to explore those things. And I want you to just experience it. I'm going to be with you the whole time. I want you to feel as safe and comfortable and confident as we can get. But I want to explore those moments that we have these reservations about our pain experience. And I want to just explore them with you. And I want to hopefully assure you that maybe those aren't dangerous. And maybe we just need to recondition kind of your nervous system and your body and your beliefs that these activities are safe to pursue, and make you and help you kind of self-manage this thing, and hopefully empower you enough to just get stronger, more confident, and more willing to engage with meaningful activities. And that's usually that's my model. It's like, I feel like I'm done with someone, and usually after I get through all that, I usually like to ask the question, based on everything you just learned. And actually at the end of all my visits with people, I send them a visit summary of everything we talked about, because it's my fear that, I don't know where I think I saw this online somewhere. It's like, you go to the doctor's office and they give you a bunch of information. Like 80% of the information that they told you, you forget. And then the 20% that you do remember, you interpreted wrong. So,
I believe it.
Yeah. So, and I will not let that happen. I send a visit summary to all of my clients, and I'm like, hey, this is everything that we had talked about. No questions about what we did. However, if you do have questions or need clarification on anything, you just reach out to me. But I just wanted to let you know that, like, this is it. This was your whole visit.
Yeah, I think that's great. That gives them something to look back on. If they've got a simple question they don't want to really reach out to you about, they can just look back there and say, well, right there's my answer.
That's right. And that's, like I said, at the very end of my visit with someone, or at the end of a follow-up, if they came twice, I asked them, I'm like, based on everything that you've learned, based on everything that we've experienced here in the gym, and based on your goals, do you think that you can, or do you feel comfortable and confident enough to handle this problem on your own? And then the vast majority of the time, those people say, yes, I think I can manage this thing. And I love that. And I've said, wonderful. If you ever need anything, like if it's a quick question or comment about anything, just shoot me a message. If it's something that you want to troubleshoot, or like really like come back in here and like figure out and play with a little bit, then just schedule a follow-up visit and we'll just troubleshoot it right here in the gym. The people that answer no to that question, that's when I start giving them options, because I like to think of more of like a personal trainer for people in pain. And that's really how I kind of used my credentials for my exercise physiology credentialing in Georgia. I worked in a clinic that specifically made exercise programs for people experiencing cardiovascular and metabolic disease. So I already had experience, writing exercise programs for people. And that's really kind of what nurtured kind of my model. I was like, yeah, if people answer no to that question, they're like, I want more guidance. And that's my goal. It's like, well, wonderful. I offer these options. I can do in-person rehab coaching where it's like a personal trainer, but you just come in at the very beginning of the appointment. We address any of your questions or concerns. We do an exercise program. And then at the end of it, I might likely give you some treatment. Because like we talked about at the very beginning, the treatment, I'm not fixing you, but I'm modulating your discomfort. I'm interacting with a super fiery nervous system And when I like do any type of treatment or soft tissue, I'm just kind of dampening that signal and just hopefully helping guide them back to like a normal functioning nerve.
You're helping control the pain while the body heals itself.
Yeah, just trying to figure it out for sure. And like I said, I think any modality is useful for that. So just choose the one that kind of resonates the most with you. If that's a chiropractic adjustment, if that's a massage therapy appointment, if that's physical therapy and all the cool modalities that they have, it doesn't matter to me. Just pick the one. And lots of people just don't even need anything. They're usually perfectly fine. They're just opt to not have any treatment. I'm like, wonderful, no problem. And then I also like to provide, there's also a group that feels like, hey, I don't really need the in-person like monitoring of these symptoms, but I would like continued guidance for when I go to the gym on my own. And I do, I'll write, I have people subscribe to an app and I'll send them weekly exercises, but usually during the first visit of their program, we will do it in the gym so that they really understand all the movements and like how I want them to be done, or how, if they have any questions, they just get troubleshooted. And then the rest of their visits are done away from the gym, wherever they feel comfortable. But a handful of people have just come up to me and like, hey, Logan, I don't really need to do the in-person or the virtual thing. However, I just want to come in for a follow-up, and can we just like plan out a program, like an exercise program for a couple weeks, or, like plan out like a 6-week thing. I'm like, wonderful. Yeah. Let's just come in and troubleshoot it. So I just want to hopefully provide any option for wherever the person is in their journey with their pain experience. Cause that's really who I'm working with. I want people that are experiencing pain to know that they don't have to be kind of a victim of their pain, and that they can really control it by finding a dose or level that they can manage it well, and then just gradually building on it. So wherever that is, and I try and provide options for all those moments because that's really what I want. I want people to feel like they can self-manage their care.
So would you say you're a chiropractor, but you're also kind of open to a physical therapy approach in a sense?
Yes. It's funny that you bring that up because I like to talk about this too, is that I think the current clinical practice guidelines for conservative musculoskeletal providers is the same. So on paper, a chiropractor, a physical therapist, an athletic trainer, how we conduct ourselves and work with people should look very similarly. It should be very hard to tell us apart. Don't get me wrong. We have very specific populations that we tend to work with. And then, of course, our treatment strategies are a little different. But on a human level, how we interacted with that person, when taking the history, maybe doing the physical exam, if you walked in and you were randomly assigned to one of those providers, my hope and the future of conservative management for musculoskeletal problems is that you should have a really hard time knowing which one of us was which, because we should all be referencing the same thing. And that's kind of adapted my model. My model is to work with a client and empower them to find a movement or behavior strategy that leads them to self-manage their care. And because I love movement, I grew up in high school. I was kind of the guy that I was always running and jumping and kind of doing kind of crazy things. And I was a track and field athlete at Cookeville High School. And then I went on to do track and field in college. I love it. I love expressing myself like that. It's just been a way for me to one of the ways I kind of identify myself as is like this, someone that loves movement. And I think that's sometimes how kind of people think of me, like the guy that just moves.
Sounds like you'd be doing parkour or something.
Yeah. I've done a little bit of that. But now that my passion for movement has evolved, and now I'm really passionate about helping other people move, especially in the presence of pain. So yeah, and I like to think that a lot of my strategy kind of looks like physical therapy because I am a movement first type of, and that's usually kind of how I describe myself on online and on posters. I usually say Logan Lamb, movement focused chiropractor or rehab chiropractor, because I really want the emphasis to be on like I care about getting you moving the way that the way that your goals are kind of suggesting for you to move, and that's what I'm really passionate about.
See, I feel like the majority of chiropractors the conventional type of chiropractor isn't going to take you through and tell you to do a workout plan, are they? Like you're saying, some people, you go through a workout plan and tell them to do this and, whatever they're trying to focus on. But I feel like whenever a conventional chiropractor, you're going to go see them and, like you said, they're going to adjust your lower back or whatever, and they're going to spend a few minutes, like you said. But you might ask them, is there anything else I can do? And I feel like most of them are just going to say, come back next week and we'll do it again.
That's right. Yes. Chiropractors out of the group, I think we're very reliant on passive modalities to help people, which is a chiropractic adjustment. The patient or client comes in, we adjust their back, and then we send them off.
And then they come back and you do it again, and
right.
you keep doing it until they feel better.
Right. Well, and then some groups, the way that however we describe the narrative of chiropractic, they don't want you to necessarily be in pain. They think you need it to continue to live life really well and meaningfully. And that's when I was describing the two practitioners, I was like, that's I don't familiar with like placebo and nocebo. Placebo is when something incidentally positive happens, that wasn't really controlled for, like a good thing that happens. So like, and that kind of goes back to that self-limiting thing. Like most non-specific pain usually gets better with time. So, but people will be like, well, no, I got better with an adjustment. I got better with cupping. I got better with dry needling. I got better with all the cool bells and whistles. And those people are probably not victim, because those are wonderful things to help modulate discomfort, but it was probably more of a placebo. Like, yes, you got better, and yes, you were doing that type of therapy when you got better, but maybe it wasn't directly maybe
there's more to it.
Maybe it wasn't a correlation to it, but there was a correlation, but maybe not causation.
Yeah.
And the same is true for when I was describing me and the other provider doing the exact same treatment for someone. That chiropractor that throws around all those narratives like your back's out, your legs short, your shoulders high, you're misaligned. That's very nocebic, and it's very easy for chiropractors to convince people to return back to their clinic when those people believe that they have a problem only the chiropractor can fix.
Yeah, I know a lot of people like that. They go weekly, or some of them even twice a week, to the chiropractor for an adjustment.
Mm-hmm.
And just listening to you here, I feel like the way you approach it is, like you said, you're probably just having 2 or 3 appointments with somebody, and I guess you're getting it in their head and getting it across to them that there's stuff they can do to be okay. They don't have to come every week to you to be okay. But on the other side, just like you said a second ago, the regular chiropractor is getting it across to them. You need this. You need me to feel okay. You're never going to feel okay. And I guess those people, it goes back to them being in such pain that they've went out for help anyway, that they never want to go back there. So they're going to listen to whatever he says. If he says you need to come in twice a week for the rest of your life, they're going to do it because they don't want to go back to that point.
Yes, that is vastly true for the majority of people when they're interacting with pain that they don't understand. And that comes down to something that I'm also really passionate about, is informed consent. So it's a little piece of paper that you sign before you go into any place, being like, hey, this is what to expect. This is what we do. This is our kind of expectations of this type of care. But what it means to me is that people need to appreciate exactly what they're about to be provided. For example, if I have someone that kind of falls into this non-specific pain camp, which what we said was like the almost 90% of people, they need to know like, hey, this thing's going to get better. However, in the past, you've mentioned that chiropractic adjustments has been a wonderful thing to help modulate your discomfort, and it makes you feel a little bit more confident to kind of continue the active things that you enjoy doing. And as long as someone doesn't think that they're being fixed and that they're broken and that they need it, but rather they think like, hey, I understand that this is a therapy that I'm voluntarily choosing to do because it makes me feel good and I'm willing to pay for it. If people are willing to truly consent to that, then it doesn't bother me in the slightest if they go and see a chiropractor once a week, as long, because they truly have consented to the care. Because like if people can spend their money on whatever they want,
Oh,
like
yeah.
I was like, I know people that just love to go get a massage. That's
I
90
mean, I like to get a massage.
100%. It's like you do that, they're not breaking up your fascia likely. They're not, moving stuff. It's like, or maybe it's just a wonderful opportunity for you to, the context of the environment is usually the thing that I think does the most value to people. What happens when you go to the massage therapy clinic? You lay down in a very comfortable environment, dark. You're on a comfy bed. You have an opportunity to just turn your brain off, and then someone's just rubbing your sore spots. Like the whole context of that to me is the magic of massage therapy. Not that they're specifically breaking up, stuck or super tight muscles and fascia. Maybe you have an opportunity to just really, you described it a while ago and it was amazing. Stress. Like stress is so huge. And that's just one of the moments in someone's busy life where they have 90 minutes where they can just truly just turn off.
Yeah, you can really relax then.
And to me, that was the therapy. It's like that was the moment, And I think chiropractors are the same. It's like whenever someone comes to interact with me, and they know, like, because I usually try and hit it home with everyone early on. Like, I'm not here to fix you. I'm here to help you and guide you, to help you self-manage this thing and, fix yourself. I don't like to use the word fix a lot, but because I don't think anyone's broken. But I love that people like to come back to me, and I invite them to come back to me. One, because they know I'm not fixing them, but two, I can just partner with them on their journey. I can just be a wonderful resource. And if I don't know the answer to a question, I'm kind of a nerd. I love just diving into the current body of literature, and I'll figure it out. If I don't know and I can't really get a good answer that I'm looking for, I will look for someone that I think has good answers and refer them to them. But yeah, that just goes back to my big thing. Informed consent. It doesn't bother me. The once a week people, if they work on a farm and they're, working with livestock and it's just an absolutely crazy environment, or they're a truck driver or they're a CrossFit athlete. Like these people are just very demanding lifestyles, and they just know that like a chiropractic adjustment just makes it a little bit easier for me to cope throughout my day. It's, because contextually it's like, I'm always telling these people, are you exercising? Are you working out? Pay me attention. Of course, everyone's busy. It's hard to prioritize that in your life. But if people, like I said, are willing to pay for it and they really enjoy the therapy, yeah, come on back. You can get that treatment. Like I said, that just doesn't bother me at all, as long as they consented to the care.
Yeah, as long as they know what's going on.
100%.
Yeah, there's nothing wrong with going every week or twice a week. Heck, you go every day if you want to.
Right.
But just, I guess where the problem is it, and not all chiropractors are like that, but the problem is with the ones that are like selling their self like you have to have them to be okay. That's where really the problem is. They're getting it in the people's head that they have to have them when they really don't.
Mm-hmm. That's it.
Because you can do stuff on your own and help yourself, like you said, fix yourself. Kind of. There's ways to do that, and that's just like having a personal trainer. You can go work out by yourself. I mean, anybody can go get a gym membership and go work out or work out at home. But it's nice to have somebody by your side helping you when you have a question. They're right there to answer your question, and they're there to dial you in more.
Right. And Connor at Apple Fitness, I love that guy. I think him and I, whenever I started to interact with him, I think we have very similar missions.
Yeah, the way you were talking, I was just thinking that too. I was like, you sound a lot like Connor about how he approaches the personal training.
Because that's how I like to think of myself. I want to think of myself as more of a guide, and I'm partnering with people just to better understand whatever their goal-oriented task is. And I think that Connor's phenomenal at that. It's like he takes the time. Like I don't want to misinterpret his model, but I think his goal is to have like 2 whole visits with people. The first visit is just like kind of like my visit is just to understand someone, really appreciate like who the human is in front of you. And then he spends that second visit exploring, just moving around the gym, just seeing how you kind of interact with your environment. And then he builds a plan based on his clinical findings, the person's goals, and then he just, if they continue care with him or training with him, similar to how I'd expect the clients that kind of pursue training with me, I just want to help guide them through, because that's what people need. It's like, hopefully people that are professionals in our field, we're a great resource to quickly bounce off questions and ideas and concerns off of. And I think that's kind of the beauty of like, as long as the clinician has the very best intentions with you and they're not misleading you or suggesting that you have a problem that you really don't, then that's what I love, when people have providers that they can closely work with, because that's just a great resource for that person. And it's just someone in their corner. Because I really feel like people just feel misunderstood. Like I said, we talked about how goofy and kind of unique a pain experience can be. And often people just want to be heard. And when they feel heard and someone actually listened to them and appreciated their experience, they feel like you understand them better. And then that just builds that therapeutic alliance that we're all looking for. And I think that's where the best clinical and training outcomes exist.
One thing that I really love that Connor does, and I believe you do it too, the way you've been talking, is you all are always reading and learning and furthering your education on what you're doing on chiropractic, personal training, or whatever. I just feel like you all are always staying up to date with the changing studies they have, because in the healthcare field, it's always changing anything. There's always these studies going on and new information's always coming out. Mm-hmm. And I really like how Connor does it. And I believe you talked about reading all the time too. So how you do it too, about just staying with the times on it. And you were talking earlier about people just stuck in their old ways. And I feel like that's a big problem across all of healthcare. Mm-hmm. Is people just get stuck on, especially like older people who's been in it since the 80s and 90s or something. They're stuck on that way and they don't care what new studies coming out. This is how they've always done it. Mm-hmm. So this is what they're always going to do, even though there's better ways and better info coming in.
For sure. Yep. And that's what, like I said, I had a mentor back in college. His name's Dr. Patrick Boylan. He's a chiropractor. I think he's in Maine now. But he helped me appreciate that we really shouldn't get stuck in our bias. Always be willing to challenge your beliefs. And because I have my personal biases, and
we all do.
We do.
We all do. That's human nature. I think that's in everything, though. I think just in everything in anybody's life, you really need to keep an open mind to people, because people, and everybody struggles with that because we do have our biases, mm-hmm. but everybody's lived a different life. Nobody's lived your life. Mm-hmm. So everybody's going to have different opinions just based on how they grew up and what they've been around.
Mm-hmm. Yeah, I completely agree, especially for people that work with people. That's why I'm like, man, we have to do our best to keep ourselves in check. I joked about this. I've told like my family and friends when I was going through school, like they would, I would describe, like, I always kind of consider there's two types of chiropractors, kind of the very traditional model chiropractor, and then like this coming of age kind of, most of them kind of describe themselves as rehab chiropractors. And like my brother would be like, yeah, which one are you? And I would say, well, neither. It's like because like that traditional kind of chiropractor has all those narratives that I discussed earlier, and then like this coming of age, and I described it in the 80s. There was this like renaissance of like rehab systems coming out, like lots of techniques for more like evidence-informed chiropractors and PTs and other conservative providers. Just everyone trying to answer the questions like, what's going on and how do we fix it? And because in school, like right early on, when I was like, I just abandoned the traditional model and I jumped over here with these guys. And then during school, I went to all the seminars. I learned all the new like rehab systems. And then over time, I was like, man, they all think that they are answering these questions, but it sounds like they just have they're just all trying to understand someone through these lenses. And I was like, I feel like we're almost doing what we were doing 100 years ago, but we're just doing it with like modern equipment. And then I was like, oh no, I was like, so I just, and that's kind of the nature of it. Lots of them kind of describe it as like toolbox thinking. It's just, you don't have to submit to a system exclusively, but you just use some of the unique aspects of them, and that seem like they can empower someone, and then just take that and go. I guess it's kind of what I've done, but I don't like to think of myself as a toolbox thinker, because I like to think that we talked about the unique kind of nature of humans. Maybe there's not a tool that fits you. It's like so, and that's my problem. Is like lots of those systems, their goal is to take the client or patient and push them through the filter of those systems. Whereas I like to just take the client and interact with those systems and maybe apply them kind of independently to you.
Yeah, pick and choose what fits the client.
Right. So kind of just having this kind of weird kind of, instead of going this way, you go the other way. And I think that's kind of the nature of how that type of model, I think, really helps kind of do the bias check, especially for people that work with people in pain. It's like we need to stay informed, and I do actually like that. Every year, if you're, I'm not sure about other providers, but like chiropractors, we need to take 24 continuing education credits, and I think that's our incentive to stay kind of up to date. Since I'm brand new to the game, I haven't really got to experience that, so it's like I don't know if those are a little bit more just trying to check off some boxes. I don't know how like really like meaningful the content is, or like even if the content that's being discussed, is it stuck in those very traditional models that we talked about, because it's easy to kind of regurgitate and kind of get stuck in those biases that we talked about. So being willing to wrestle with that, and that's what I do online. I follow a bunch of, I think, I follow a bunch of providers and clinicians that are willing to challenge their bias and then just kind of engage with the literature, with an open mind, and be okay with experiencing something that may not resonate with you, and but being willing and kind of like having some humility and just being like, hey, I didn't really appreciate this at the time, but maybe this is actually maybe the way that medicine needs to move to give people the best care that they deserve.
So is there like a national board and a state board of chiropractic that you're part of?
Yeah, I had to apply and get I'm licensed in the state of Tennessee. You have to get an independent license in whichever state you want to practice in. So I currently only have a license in the state of Tennessee. But yeah, I guess there's a national board that I guess regulates all of those. And I know that each state has its own like kind of the the TCA, Tennessee Chiropractic Association. They just help kind of, which is actually a really cool program in the sense that they kind of whenever there's like new legislation, they go to the Capitol, and whenever there's like advancements in chiropractic, or like getting chiropractic more involved in kind of healthcare, I think they're kind of going to bat for us all the time, which is cool.
One thing I really wanted to ask, what would you say to somebody who's worried about the safety of being adjusted? Because I know that's a big thing, and there's a lot of people, especially when you're working around the neck and the back and all that, that's a big concern for a lot of people.
Yes, and that's a wonderful question. So a chiropractic adjustment truly is, and this is, I'll backtrack a little bit. Before I met Connor, when I emailed him in the fall of last year, before I met him, I was going to graduate and exclusively do telehealth medicine. I was going to do all virtual consultations, because how I described my model, I was like, I can do all of that virtually. Because I'm one of those weird people that left chiropractic school and felt super comfortable to never adjust anyone. Because don't get me wrong, I think it's a useful tool how I described it. But I was like, I don't think I need to do that to help people the way I want to help people. And then I met Connor, and that's what started my journey with him. But all that to say, even as someone that was willing to not do adjustments leaving school, chiropractic adjustments for the vast majority of the time are very safe. It's a very safe modality, and often it's very very comfortable, and it's often very very relaxing. It usually brings a lot of relief for a lot of people. Regarding the neck, I think there has been some literature you know, that what goes back to our kind of correlation and causation thing, because lots of I think the evidence kind of around cervical or neck adjustments and maybe some adverse effects, like I think the most common one people describe is like a stroke. I don't think that there's great evidence to say that there's causation that exists there. I think that the person that went to the chiropractic office that went in with neck pain, because that's a pretty common problem, and then cardiovascular people, cardiovascular people that are dealing with cardiovascular disorders experience neck pain, and then when they get their neck adjusted, there's a chance that that person was likely going to experience a stroke anyway, but they happen to have gone to a chiropractor because they were seeking relief from neck pain. So, and I don't think that the chiropractic adjustment was specifically the thing that may have caused that. My concern is that I believe the chiropractor maybe should have done a better job of ruling out those red flags.
They should have dug in a little more.
For sure, for sure. So, and that research is continuously evolving. So, because if someone comes in and we do those vital signs on them and take their blood pressure, and then kind of understand kind of the diagnoses that they come in with, I'd be like, hey, maybe you're not the best candidate for a cervical manipulation, a neck adjustment. However, and here's the wonderful thing is that there's wonderful literature, specifically even for treating the neck, and that there's been randomized control trials where they'll take a bunch of people experiencing very similar neck pain presentations, and they'll randomly assign a group to exclusively a cervical adjustment, or like a neck adjustment, and then they'll put another group where they just get some light soft tissue stretching done. There's no rapid twist or anything. They just lightly mobilize their neck really easily. And then they have a group that gets none of the treatments and they just wait. And then what's interesting about all those three is like the group that got the neck adjustment and then the group that didn't get an adjustment, but they just got their neck stretched, clinically, they actually performed very equal. So like they had very clinically significant findings in the sense that if someone comes in with neck pain and you believe that they wouldn't be a safe candidate for a chiropractic type of care, then you can just as equally employ a different strategy. Like it's not even required. And I think people need to be, clinicians, we need to do our best to take a good history and exam to make sure that someone is an appropriate candidate for that type of care. And then two, if we decide that maybe they're not a great candidate, we should be able to perform other options for that person to still bring them relief without exposing them to the potential risk of adverse effects.
Yeah, you still should have some way to do it safely.
Yeah, for sure. And when we can tell them like, hey, and an option, another option that day is to simply not treat them. And we need to be okay with doing that too. Like, hey, based on all the clinical findings and some of the things that you told me in your medical history, I don't think that you're a great candidate for care today. I would actually maybe seek out your primary care and have them perform this, and this test, maybe get an image of your neck and upper back, just to make sure that this care is appropriate for you and that you're a good candidate, and to see if like this might be an option for you. But that's another part of our job. After the physical exam and the history, in that informed consent category, or like in that time where we're delivering an informed consent, our job is to give people options. So they have an option to seek care from us today. They have an option to maybe not seek the specific care that we usually provide, but maybe an adjunct to it. They have an option to seek other care from another facility or group, or they simply don't have to pursue care at all. But lots of people don't really go through the nitty gritty of that. They usually say like, hey, yeah, today, this is what
you need to do this.
Yeah, you do this for sure. So, and yeah, that's what I think is informed consent. Just giving people all the options so they better understand their pain experience, and then going from there. But yeah, back to your original question, a chiropractic adjustment is wonderfully safe for the vast majority of people experiencing the vast majority of musculoskeletal disorders. But my nuance to that is that so are almost all other things. So, and that's my encouragement to people. It's like, yeah, there are definitely options out there. However,
You just got to choose the right option for you.
yeah, just pick the right one. Hopefully that provider's communicating your options well. And then hopefully when the provider is performing the actual treatment specifically, they're communicating with you along the way. So like if I was going to adjust someone's spine, before I do, I usually set them up in the position that I would perform the therapy in. Be like, hey, this is exactly how it's going to be. The only difference is that I'm going to just add a little bit of force. Are you comfortable with that? And then they will say yes or no. And I'm okay with that. It's like, yeah, let's do it. And then I'll do it and it'll have a big crack and it'll feel good and, you know, we'll have no problem. But sometimes I'll get a no to that answer. Like I'll be working with someone's neck and I'll be like, hey, this is the kind of the position that I would take your neck, put your neck in to kind of get this type of treatment. Are you comfortable with that? And I've been told no, and that does not hurt my feelings at all. I'm like, hey, no problem. Would you be interested in this other type of therapy? And then oftentimes they're like, yeah, sure. And then I'll stretch them out or do whatever I was going to do. But people need that. People need to feel like they have control of their autonomy. It's like people need to know that they can kind of control kind of their clinical environment, even though it's easy for them to just kind of be led the whole time because they just trust whoever they're talking to.
Yeah, a lot of people just blindly trust whoever they go
Sure.
to, but I think it is nice to give them those options and let them decide because nobody knows theirself better than theirself.
Exactly. That's it right there.
What advice would you give to somebody wanting to get into the chiropractic field?
Oh, someone that would like to pursue the profession?
Somebody out there, if somebody's listening, they want to be a chiropractor, what would you tell them?
I would really encourage them to do some soul searching, and I would really want to know kind of. Usually, people that get into chiropractic, the most common story that I hear is that usually it's an athlete, and they're like, yeah, I was, postseason, we had districts coming up, but my back, I just was in so much pain. Went to the chiropractor, he fixed me, and then I was able to play, and that just inspired me, and I want to do that for other people. And that's like the most common one I've heard. Just people have had their miracle moment, but often, and how I described it a while ago, is like maybe they just got their pain modulated really well because they probably really didn't have like an actual tissue problem in the first place. So we really kind of distracted them as they were continuing to heal. But it's they didn't know that, and I didn't know that when I started school. I'm continuing to learn that, But if you're going to go to chiropractic school, I'd encourage like, why? What are you trying to gain from it? And do you believe that chiropractic is the only way to kind of do what it is that you're looking for? Because if you're just going there to crack backs and just hop on this wheel of just kind of continuing care, then my hope is, I was like, man, I hope that you wrestle with that and just do you think that that's going to be fulfilling for you? And do you think that that's how kind of modern medicine in the conservative space is moving? Because I think it's moving away from that model. And I think that's kind of the model that kind of attracts people in the first place, because it's all over the internet. Everyone has seen chiropractic videos and people laying on tables. And
there's a lot of chiropractors out there on TikTok and Instagram and all that, making videos of them popping somebody, cracking somebody.
And I was one of them. Like in 2021, when I was actually deciding to go to school, I was following a bunch of those accounts because I was like, wow, this is crazy. That's amazing. But now I'm like, oh, man, usually those people that they have on the table are just usually younger, healthier. They already move really well.
Usually not what you're seeing in the normal day to day.
Yeah, and often the people that are in actual serious pain, most of those times that on the video, they're told kind of that nocebo, kind of like biomechanical reason for their pain, which kind of makes me a little sad. And then 2, we never see them come back, because it's easy to make someone feel really, really good in the moment. Mm-hmm. But I want to know what that car ride home was like.
What they're feeling the next day.
I want to know how they woke up or the week later, because we never get to see those videos.
Yeah, I never really thought about that.
Yeah, we only see those magical mic'd up moments.
Which that's everything on social media. You're only seeing the best of whatever somebody wants to post. You ain't going to post something bad about your life on there.
No, for sure. And Yeah, because I don't follow any of those accounts anymore, but I can see how that's just enticing for people, and it's kind of tough for me. And that I've wrestled. I've told Connor about this. I'm like, man, I've just done so much personal wrestling with just being labeled a chiropractor, because people's first impressions of me, they already have this. We just talked about bias a little while ago. It's like people already have this assumption about me based on my title. And because I told him this, I was like, man, if I really could identify myself as some kind of term, I'm just I'm a clinician who works with people experiencing musculoskeletal pain. Like that's if I had to just nuts and bolts, that's what I do. Because I like to think that, and I told you like we're most providers are referencing the same guidelines, so like we shouldn't look much different. Chiropractors, PTs, trainers, like we're all referencing the same. When they get published, like we all should be reading them. Like, oh, if we're all really doing that, then we all should look pretty similarly. So all the kids that want to go to chiropractic school, I actually will, and it actually really hasn't happened to me yet. I've had conversations with kids that want to go to PT school, and I've had kids that want to go into nursing, uh, reach out to me. They're like, yeah, I want to go into these fields and work with people in pain. I'm like, awesome. I'm going to send you a few papers to read, and I really want you to wrestle with them, because what you're about to walk into, you're going to get taught how to do it from that particular lens. And I want you to appreciate that humans, viewing people from our very specific lenses, like where I'm touching you on the elephant, that doesn't represent, it's like, I don't know if it's actually an elephant. I just know it as the thing that I'm touching. So, and I usually send them that Kolecki paper that discusses pain. I send a paper that's called Beliefs About the Body and Pain. I can't remember the author's name off the top. Camarillo or something like that. But he does a great job of just being like, and that paper discusses like it just follows this man who dealt with chronic pain for a decade, and like he went to chiros, PTs, orthos. Everyone told them what their bias was. He had this out of place. He had degenerative disc. He had weakness here, and then he met one of he's not a mentor of mine, but he's someone in this space that I admire. His name's Peter O'Sullivan, and he kind of coined this I don't like to use the word system, but I guess it's called a system. It's called cognitive functional therapy. It's kind of how I base my model off of it. It starts with making sense of pain, which comes from that storytelling, just understanding someone's problem, and then helping them understand it. And that's a big part of, like, after I do the physical exam, I just do like an educational moment. I just spend a little bit of time like, hey, based on everything I learned about you, this is what I think's going on. And then after that, we expose you to those movements that are concerning for you. I like that model because it doesn't require any of my own bias. It doesn't force me to just filter them through any system. It's just them. And that's what that's what I encourage young people wanting to move into healthcare. I'm like, if you read these few papers and just appreciate, like, you're working with people that you might not ever have the answer, and you need to be okay with that. And you need to be okay with maybe not making up an answer that you're going to be told is the answer in your program. In chiropractic school, I was told there's like 8 answers to very specific problems, and I graduated and I left them there. I'm never going to tell people that they have one of those problems, like they have a misalignment. I just won't do it because I know it's not empowering to them. I know it's physiologically and anatomically not true. And it doesn't really serve any purpose other than keeping them tied down to me. And that's what I tell them, like, hey, you need to wrestle with this. Like, you really, because I love it. Like, would I go back and do chiropractic school again? Honestly, just the way I did it, I am so thankful, because how I'm practicing chiropractic is exactly how I'd like to think that it's hopefully going to evolve into. And I graduated with a lot of cool people that I think share that vision. Like, how can we just empower people to just take control of their care? And that's what I encourage students maybe pursuing professional careers, is like, you need to be okay interacting with people that you don't have, that are just so complex, and you need to be comfortable just not knowing all the answers, and you need to be comfortable kind of evolving with medicine. So if you're not really willing to do those things, then I think you're gonna have a hard time. But yeah, that would be what I would tell those young people.
Well, I think we've basically covered everything I can think of. It's been a great conversation.
For sure.
Definitely been interesting. You've definitely got an interesting approach to how you do things, and I like what you said. I like the way you go about it, and it feels like you're definitely authentic in that you're just wanting to help people and wanting to help them to be able to manage their pain themselves and continuing on in their life pain free, hopefully.
Mm-hmm.
Do you have anything else you'd like to say?
One last thing. I just recently started a practice kind of based in Cookeville.
Yeah, I was going to say, if you want to, just go ahead and drop your how to get a hold of you and your Facebook, Instagram, whatever you want to say.
For sure. My practice is called Illuminate Health, and I don't have all the fun little phrases for why I chose Illuminate, but I love the concept of like a light bulb kind of representing kind of just like creativity, kind of like this enlightenment, like you're learning something new, and that's kind of the perspective that I'm trying to bring to health and the health and wellness space. Is like something fresh, because like most of the time when people interact with me that are in pain, they likely hear something that they've never heard, and then two, they hopefully leave feeling more confident that they can control their problem, and that's kind of what I want to provide, and that's really what kind of inspired my model. But my website, my social medias, I'm on Instagram, Facebook. I'm trying to get onto YouTube. I've been trying to figure that out. I'm not a great content creator. I've been just kind of winging it this whole time. But all of my tags are Illuminate Health MWC. MWC is a movement and wellness collaboration, because that's what it really is to me. Is like I'm collaborating with people as opposed to leading them directly. I want it to be a partnership. And I'm posting mostly on Instagram. I have a lot of good content. I usually like to post in a series where I talk about pretty common topics that I think are misinterpreted. I did a pain series, and then I did a flare-up series. I recently did I was going to call it a debunking series, but I thought that was a little too harsh. So I called it a fresh perspective series, but I interacted with the term posture, stability, and one other one I can't think of off the top of my head. But just very common topics in healthcare that I don't think people understand. So if anyone ever wanted to go and interact with those, they could. And then I did it in May, but I think I'm going to continue on. Actually, it's going to be my new thing. I did free first visits throughout May, and it was just wonderful. And I think I'm going to extend that offer at the moment indefinitely, because I just want people to come in and learn about my model, and then hopefully just have a good experience and feel like they can manage their care independently.
Yeah, that sounds awesome. Well, there you have it, everybody. If you're in any kind of pain, go check out Logan. Free consultations. It's definitely worth giving it a shot and seeing what he has to say. And we thank you for coming on.
Yes, thank you so much for having me.
And like I always say, thanks for listening. Subscribe to the podcast, and have a good night.